Welcome back. May is Skin Cancer Prevention Month, and we continue our discussion this morning about the deadliest type of skin cancer, melanoma. Dr. Edward McClay and Joel Moody, who is being treated for cancer, join us this morning. Thank you both for being here. Joel, you were diagnosed with melanoma 6 years ago. You're a lifelong San Diegan. Yep. I imagine you've spent some time in the sunshine.
Yep, a lot of time.
Tell us your story.
Well, my story is pretty long. Like you said, it's been 6 years. Obviously, being born and raised here, ever since I was probably 12 years old, I'd go surfing every day. Being in San Diego, being in California, it's always everyone wants to have tan and be tan and look nice. And so I was definitely part of that. So I would, lay in the sun, surf, tanning beds, all the way up until, even into my 20s and 30s. And so, unfortunately, like I said, 6 years ago is when I started this whole sort of journey. And since then, it's been a lot of sort of cutting and slicing and dicing and scars. And in the last 6 months, I've had even 3 surgeries. And unfortunately for me, it's progressed to the point where it got into my lymph nodes. And so it's sort of gone a step further than just the superficial melanoma that you get on your skin. And so once you start seeing oncologists about different treatment plans, then it becomes real to you.
And doctor, you have been treating him and dealing with his case, Joel's case. Tell us, is this a typical story that you see? Joel, you had where was your first mole found?
My first mole, and actually, and that's kind of a funny thing, is I don't even know it was a mole. I just happened to sort of be prodded into getting a screening. And it looked like a freckle to me. And so it was really hard for me to detect that anything was wrong. It didn't itch, it didn't look funny to me, but a little freckle that was on my chest is how it all started.
Wow. And is this a typical way that people are diagnosed?
Unfortunately, it is. Many times people do not know that there's anything wrong. The photographs that you showed earlier were of very obvious melanomas. And when a person is diagnosed with a melanoma that looks like that, that's a pretty advanced situation. So Joel was found very early with a very minor changes in his initial melanoma, which is the best way to do it. And so his first melanoma was a melanoma in situ, which had no biologic risk. But his second melanoma had in fact begun to invade, was not diagnosed early enough, and had the opportunity to move into the skin, and then from the skin was able to get into lymphatic channels and into his lymph nodes.
Is it common for someone to have 2 different melanomas?
If you look at individuals with melanoma, about 8% of them will have a second melanoma. If you develop a second melanoma, there's about a 20% chance you'll develop a third. So it does seem to increase.
What Joel was talking about, slicing and dicing, he said that sounds so archaic, but what are the treatments for someone with melanoma that has spread?
Well, the first defense, the first treatment is removal. If we can get it early enough, before it has had the opportunity to reach the lymphatic system or the blood system, it's 100% curable. However, once it invades deep enough, it then gains access to both lymphatic vessels and blood vessels. And once a cell gets into that system, it can wind up anywhere. So once, depending upon how deeply it has achieved and whether or not the patient has had a sentinel lymph node that's positive, if the patient is at high risk, then we talk with them about preventive therapies, trying to take their risk of the disease coming back and lower it, and treating them with what we refer to as adjuvant therapy.
So what kind of medications or drugs are used to help people combat melanoma?
Well, one of the things that's really exciting right now is things have exploded in the past several years. I started melanoma research in 1984, and from then to 2011, we only had 2 medicines approved for melanoma. Since 2011, we have had 4, and there's 2 on horizons. And they basically fall into 2 categories. The first is what we refer to as targeted therapies. The billions of dollars that we've spent in cancer research are beginning to pay off. We had to learn what was different between that normal cell and the cancer cell. We know a lot about that now. We don't know enough, but we know a lot. And the things that we've learned are that there are pathways that are mutated, sort of like an electric switch, turned on the on position, make a new cell, make a new cell. We've learned that those kinds of pathways exist, and now we're designing medicines to turn them off. So we now have 3 new medicines in that regard for melanoma patients where the disease has spread. The other big push is the immune system. We've known for decades that under the right circumstances, the immune system can kill melanoma cells. Right now, we've had one new medicine approved. We have 3 on the horizon that we think are going to be approved in the next 6 to 12 months.
And these are medicines that are injected into your system, and they help your own immune system fight the cancer?
Exactly. Exactly. Now, the first 3 we talked about were actually pills. Many of the new medicines coming out are oral agents, but still the intravenous type are still, unfortunately, because it's more problematic for patients, but they're still available.
All right. And Joel, so this journey, it's been 6 years now. So what are you doing now to keep your health in check?
Yes, so for me now it's regular screenings. For me, someone like me in a high risk, I go every 3 months. But for normal people, I definitely recommend to get it at least once a year. I know a lot of friends that I talk to, they're always telling me when they know about my story, they say, oh, I have this funny thing here, but no one ever does anything about it. So I'd encourage everyone to get your regular screenings. And then going back to me, for me, it's the 3-month screenings, and then it's the protection, the sunscreens, making sure I'm not out in the sun, especially at peak times. Just a lot of preventative things that you become a lot more aware of than just sort of going out and enjoying the sun.
I mean, I know most of us don't think we're going to get some sort of a deadly disease, but did you ever in your life think that you'd get melanoma?
Absolutely not. No, it's definitely eye-opening. You know, you get the skin ones, and that's definitely sort of scary. But again, as Dr. McClay said, you get them early enough, you're able to remove them, and there's a 100% survival rate on something like that. But once they sort of penetrate below the epidermis, then again, you're dealing with a whole different animal. And so now, for me, unfortunately, that's become a reality, and it's a life-threatening thing that I'm facing. And so, you know, it's scary to think that you can just prevent it by sunscreens or screenings, and there's just easy prevention for people to do to not be in a situation like I am right now.
Joel sounds like he's got a pretty good grasp of what's going on. Is counseling and that sort of thing provided to patients who maybe have a more aggressive type of cancer, skin cancer?
It starts with your physician and discussing the options and trying to lay out the different options that are there, the pros and cons of doing something, doing nothing. But there are a number of people who help us out. We have a counselor that's part of our group that is willing to meet with patients and help them through. This is not anything that anybody expects to happen to them. And it hits you right between the eyes. There's no preparation for it, and all of a sudden it's there, and it's a life-changing event.
It certainly is. Well, we're going to continue our discussion as when we come back from this short break. Still ahead on San Diego People, Dr. Melanie Palm will rejoin us as we explore an upcoming event that is going to be happening to benefit the Skin Cancer Foundation, and we'll show you how you can participate in raising money and fund research in finding a cure.